Hello. Today, all over the world, against women and girls, there is one of the most harmful practices for them. So we are here together for that. So we'll be talking about child early and forced marriage. One out of every 5 girls in the world is married. And today, 33,000 girls will be forced to marry. And every year, 12 million girls are forced to marry when they are a child and they are deprived of health, education, and employment rights. And unfortunately, in Turkey, these harmful practices are common. It's one of the countries that is common. So especially in Turkey, every 5 out of 10 women in Turkey has been forced to marry during childhood, and they become mothers. Yes, the numbers are very sad, but they give us very important things. So data, statistics are very important to put the issue clearly forward. So today we are here because of this scientific report, which will cast a light upon this issue. So for 50 years, for girls, for children, for vulnerable groups, for an equitable world, UNFPA is working. UNFPA Turkey, Hacettepe University Population Institute, to prevent this child early and forced marriage in Turkey, to contribute to these steps. There was the data analysis of Turkey Demographic and Health Surveys for 1993 and 2018, and it had the data analysis. So the name of the report is Child Early and Forced Marriage in Turkey, Data Analysis of Turkey Demographic and Health Surveys 1993-2018 report. So with this report, the marriage age, pregnancy, birth, maternal and infant health, and the attitudes of spouses within marriage. So regarding many indicators, for a 25 years of time period, all the findings are put forward clearly. So with this report, our goal is to see the studies going on in this field and to provide a legal, scientific basis, and also for the prevention programs to provide a scientific basis, and for everybody carrying out advocacy activities to act as a guide. We would like to strengthen this struggle. So today we will be launching this report under the UN umbrella, of course. And we have the partners here, UNICEF, and also the funding agency of the program is SIDA. So we are together with the representatives of these agencies. So what is our program? I would like to summarize it. First of all, we will be listening to the agency representatives who will leave after their opening remark. Hasan Mohtashami, UNFPA Turkey representative, so he is with us. And Regina de Dominicis from UNICEF, so she is the UNICEF Turkey representative, and she will be with us. Malin Stave, head of development cooperation, SIDA Turkey, she will be with us and she will greet us and she will be rendering her opening remarks. After that, so the study that photographed 25 years of Turkey will be presented by our experts, and we will be listening to our responsibilities. And during the presentation of the report, we will be listening to Associate Professor İlknur Yüksel Kaptanoğlu, who prepared this report from Hacettepe University. And we will be listening to the report from her. And also Emine Kuzutürk Savaş will be with us. She is the CEFM program manager from UNFPA Turkey. And she will be showing us a video footage too. Then, when we have listened to the details of this report, we will come to the evaluation of the findings and the responsibilities. What are our responsibilities? Who should do what so that they can contribute? So to talk about all these, we will be having a panel. So on that panel, whom we have 4 valuable names will be accompanying us. Dr. Gökhan Yıldırımkaya, UNFPA Turkey Sexual and Reproductive Health Coordinator, will be with us. And Professor Pınar Okyay will be here. She is the president of Association of Public Health Specialists. And also journalist Başak Çubukçu is here with us. So we will be listening to her. And also UNFPA Turkey Ambassador, Didem Balçın, actress Didem Balçın, will be with us. So we will be preceding the panel with these 4 people. And after the panel, I would like to remind you of that if you do have any questions or if you do happen to have any comments, you can share all those with us. I would like to welcome you all. So this will be the program of today. So now for the opening remarks, we can start. So the first speaker is the host of our event. So UNFPA Turkey Representative Hasan Mohtashami will be with us. So Mr. Hasan Mohtashami, the floor is yours for your opening remarks.
Thank you. Thank you so very much, Madam Moderator. I really appreciate it. I welcome all the distinguished participants, colleagues, friends, and partners to this launch meeting. Really appreciate that. On behalf of UNFPA, I also appreciate very much the work done on this report by Hacettepe University Institute of Population Studies. I am an outstanding partner for all of us in the development community. They have done an outstanding job on different surveys and studies throughout the years, and we are really in depth for their work on many fronts. The topic is clear. Child early forced marriage is a violation of human rights. Just imagine that if a young girl is married off, she will lose all the opportunities for her education, her employment, her future is in question. And the agenda that we have, all equality between women and men and empowerment of women is under question. We are very grateful to our partners, particularly Swedish Embassy here and SIDA in their capital, that they are supporting a joint program within the UN system. We are led and coordinated by our sister agency, ably and competently, UNICEF, taking lead on this joint program, and we are part of it at UNFPA together with other partners, UN Women, UNHCR, IOM, and UNICEF themselves. They have some activities as well. In UNFPA, we are focusing on capacity development, mainly. Some of the activities are designed to develop the capacity of service providers in different sectors to help the reduction of child early and forced marriage in Turkey. We are doing also some community-based activities, but traditionally, as it is in our name, we are UN Population Fund. So we are concerned about data and population numbers and figures. So as a result, we do support activities that are related to generating data and information on different fronts. And hence our support to this study, which is a comprehensive, long-run and comparative study on different data sets, the analysis done by the Institute of Population Studies at Hacettepe University, and we are grateful for them. And I hope this report, this data analysis provides some opportunities for the policymakers, program planners, development partners, and everybody who is concerned about this topic, so that they can reflect on these figures. And yes, we have improved some of the indicators throughout the years, but still, even one girl child is a world, and we need to think more about the trends and the figures as depicted in this report. I invite everybody to look into the reports and the results of the reports more in depth and critically, and hopefully we can reach to the stage that we have a zero on many of these indicators. No young girl is married off before the age of 18 and can fulfill all her potential for a very productive and healthy life. Thank you very much, and I welcome you all again. Thanks. Back to you, Madam Moderator, and thank you for outstanding job you're doing. Thanks.
Thank you very much, Hassan Bey. As Hassan Bey mentioned, one girl is, of course, very important. So UNFPA said that numbers are our work, as Hassan Bey mentioned. So we will be talking about those trends and figures in detail. We will be learning them. But now, so CFM in Turkey and their last 25 years in Turkey. So this report is analyzing that, and UN within the program of prevention of child and early and forced marriage in Turkey. So there's a UN joint program. And one of the implementers of this program is UNICEF. And we would like to listen to UNICEF Turkey representative Regina de Dominicis. So I would like to leave the floor to you on behalf of UNICEF. What would you like to tell about this program?
Thank you very much, Sedana. So, my dear friend Hassan, UNFPA Turkey representative, and dear Malin Stau, head of the pre-accession and humanitarian assistant, a great friend to the Swedish International Development Cooperation Agency around the world of the UN agency delivering on this important topic, and distinguished doctor and expert from the Hacettepe University Institute of Population Study, but as well dear viewers all around Turkey. I'm really very happy to be with you today at the presentation of this important report, as very well explained by my colleague Hassan. The elimination of child early and forced marriages is a specific target, as you all know, of the Sustainable Development Goal agenda. It's a global agenda that has seen some progress in the last years. And of course, one of the area where we have seen a positive trend was the area in the past of the early marriages. We witnessed a global accumulated reduction of 25 million marriages that would have anticipated 10 years ago. So we should not forget that the progress has been there. But unfortunately, many of us know that when a humanitarian crisis strikes or where we have pandemic, like the one we are living, unfortunately, the progress can be easily reversed. And we are witnessing with really worrisome trend right now that are making children more vulnerable and forced to early marriages. This means that to end the practice that we see and to stick to the goal of 2030 agenda, we need to significantly accelerate together the efforts. As you were mentioning, Sedana and Hassan Bey, in Turkey, UNFPA, UN Women, IOM, UNHCR, and UNICEF have come together under the UN Joint Program for the Prevention of Child, Early and Forced Marriages, under the leadership of UNICEF, but of course nothing would have been possible without the policy and financial assistance as well from the Swedish International Development Cooperation Agency. The joint program takes an holistic approach, and actually we build on the comparative advantage of each of the UN agency and the specific expertise that we have in-house. Why? Because the issue of early and forced marriages is very much linked to different areas. And coming together allow us to tackle them in an integrated way. So we look at violence against women and children, a child protection aspect, education aspect, health, human trafficking, but also humanitarian and resilience dimension. The joint program has contributed to strengthening both national and local institutional capacity to, first of all, identify children at risk, then establish effective prevention measures to provide high quality services to the survivors. And children and families that are most at risk of child marriages have benefit from community-based intervention to know and to claim their rights, first of all, but also to work on changing the social norm and attitudes around child marriages. So in line with this global commitment, also the UN cooperation framework that will start to be implemented from 2021 to 2025 in Turkey prioritize this area of work. And to this end, I joined the colleague actually in believing that the funding from this study, and again thanking Hacettepe University for their absolutely precious contribution, because the study will help us to understand better the social and economic drivers of this phenomena, but also the psychological, social, and health consequences, the trends that are related to child early and forced marriages in Turkey. So with this scientific evidence, we will be able to do and to sharpen even better our programming and our advocacy for supporting the development, but also, and especially most importantly, the implementation of the strategies and action plan that the government will put in place. And once again, distinguished audience, I would like to end my remark by actually reminding that this is a call for all of us, all of our organization, all of our network, but also for every member of the society. We need to work together to protect the most vulnerable and support women and children's rights. And we need to be even more aligned in challenging time to achieve gender equality for every child. Çok teşekkürler.
Thank you very much, Regina de Dominicis, for these valuable messages. It was very important. Before all, there is a progress made. She reminded us. So this is a promising point. So there is progress, but of course, crises and also the pandemic that we are in at the moment. Yes, it may worsen the struggle. Yes, we do know this. As Regina underlined, it is a financial support. Without financial support, this struggle would be more difficult, and it cannot be even happen sometimes. So in terms of financial support, this very important report and program, its financial support is coming from SIDA, and SIDA Turkey representative, Swedish Embassy to Turkey will be speaking now. Yes, Malin, now the floor is yours.
Many thanks, Seda Hanem, and thank you for organizing today's event, UNFPA. Greetings to you all from the Embassy of Sweden here in Ankara, and also from the Swedish Development Cooperation Agency, SIDA, that I represent. I wanted to start with a quote from an activist who've been working on this topic in somewhere else in the world. My dream is to see more girls finish their studies, which will help our country to progress and break the cycle of poverty. If I am poor and have a baby at the age of 16, 17, my baby will very likely also be poor, and this creates a cycle. These were the words of an 11-year-old Honduran youth activist working on to end child early and forced marriages in her country. But as we have already noted in our opening remarks today, thanks to the devoted work of activists like her, volunteers, professionals, and policymakers, there has been a decline in the number of child early and forced marriages in the world. But unfortunately, we still have a very long way to go to end this harmful practice. And figures confirm, as have been already noted, that we need really to speed up our efforts. Every day, 33,000 girls are getting married on average. And with this pace, if it were to continue, 150 million girls will be married before their 18th birthday by 2030. And this is, of course, unacceptable. Poverty is one of the most significant reasons of child early and forced marriages. And for some families, it's considered as a means to secure a future for their daughters or to protect them from violence. For some, it is a less mouth to feed, and sometimes girls are even considered as commodities to straighten up family finances. But as vividly depicted by the Honduran activist Celia that I quoted, child and early and forced marriages really adds to the challenges of reducing poverty. And it is also obviously a very major gross human rights violation. It is a form of violence against girls and women. Another root cause of child early and forced marriages is gender inequality and gender norms that lead to inequalities among boys and girls, women and men. The gender norms and inequalities embedded in societies and cultures lead to discrimination towards girls. and women. Many girls drop out from school and they are deprived of their right to education, among other things. And without proper education, they cannot claim better lives for themselves and be employed to build the decent living conditions for themselves and for their families. Living in conflict-affected areas, or being subject to forced migration exacerbates the risks for child early and forced marriages. And we must pay particular attention to girls and their families living under such conditions. And there are solutions to child early and forced marriages, but they require the commitment of all of us, policymakers, governments, and international organizations. We should work for enforcement of the existing laws and policies, support education beyond primary school, and employ efforts at the community level, and most importantly, create safe spaces for girls. Since child early and forced marriages are a global problem across countries, supporting work to end it also requires a unified and determined approach on all sides. My country, Sweden, and its development cooperation agency, SIDA, which I represent here in Turkey, we therefore contribute to efforts in this direction in many countries around the world. And we've come together today to learn from this new and very important comprehensive study on child early and forced marriages in Turkey, based on official available data from the years 1993 to 2018, which will provide us, I believe, with an even better base for addressing the phenomenon in Turkey going forward. Sadly, as has already been noted also by my colleagues, we know that the COVID-19 pandemic and the restrictions that come with it has reinforced the known factors behind the practice, and the number of girls subject to this form of violence are now on the increase in Turkey. As Sweden, we firmly believe in creating opportunities for all individuals to develop their full potential and have the power to raise their concerns, needs, and rights in an informed way. And we're really proud and happy to be supporting this UN joint program led by UNICEF, but with equal participation of UNFPA, our host today, UN Women, UNHCR, and ILO is part of, that works to end this harmful practice in very close collaboration with the responsible Ministry of Family, Labour and Social Services. It does so by working towards changing the social norms and attitudes at community and national level, and by strengthening the capacity of and coordination between different actors, and they're all equally important: state, municipal, civil society, that provide services to families with girls at risk of early marriage. And by supporting this program, we hope to contribute to creating opportunities for girls in Turkey from the Turkish society, as well as girls from refugee families, and support them in reaching their full potential as individuals and family and community members. And as noted by Regina, this is of course also a very critical part of realizing the Sustainable Development Goals in Turkey. And there are very specific indicators in that framework that we may follow to track progress. And with that, I thank you for your attention, and I wish us all a fruitful conversation today on this very important topic. Back to you, Sedana.
Thank you very much for your valuable support and contribution. You have also touched upon the reasons of child early and forced marriages. And what I understand also from the report is that I have realized that these are all interconnected and these are all feeding to one another. So these reasons are all interlinked. Poverty is a very important reason for those marriages. So it's the top reason why they get married at an early age. And there are also some traditions that are very well rooted in the community. Coordination, cooperation, these are critical. So we would like to thank all the institutions and organizations and their representatives for your great support. Mr. Hassan, UNFPA representative, Ms. Regina, UNICEF Turkey representative, and also from SIDA, our representative, Malin. Thank you very much for also shouldering this burden, for also contributing to this fight against the child forced and early marriages. Thank you very much for your contribution and your great support once again. So we have 3 great representatives. They have shared their valuable messages with us. And at this point, they are about to leave our event. And from now on, we will be starting to discuss the details of this report covering 25 years. And later on, we will have the panel session. So we are very excited to learn about the results, the findings of the report. By the way, we have many viewers, everyone who are listening to us currently. If you have anything to contribute to the discussion, please feel free to do so. Under the video on YouTube, you can leave your comments. If you have any questions for our participants, I'd be very happy to convey your questions to our speakers. Now it's the time to listen about the report covering and analyzing the 25 years of child marriages. From Hacettepe University Institute of Population Studies, we have our distinguished professor to deliver the findings of the report. Please, Ms. İlknur, over to you. Thank you very much. Thank you, everyone, for joining our event. I would like to thank everyone. I would like to thank UN. I would like to thank SIDA. And I would like to also thank especially UNFPA for organizing this event. Soon I'll be sharing my presentation with you, but I would like to underline once again that this is the produce of common work, of joint work. We have carried this work with many colleagues jointly. They have contributed a lot. Also Gökhan Yıldırımkaya and Emine Kuzutürk also contributed to the preparation of the report. There are much more to what I'm going to talk about here, but I'll do my best to fit in the time allocated for my speech. Now I'll be sharing my screen with you all. Hopefully you can see my screen now. Hopefully there is no problem. So it was mentioned actually, but I'd like to make a brief introduction as well. Of course, we will be focusing on the rights of women, on children, but this is also valid for boys. But today we will look to the topic from the perspective of girls. And we will be mainly focusing on the data analysis of child early and forced marriages. And we will be covering the analysis of the last 25 years. And hopefully we will be also talking about the steps to be taken in the upcoming future. So child marriage is a very important topic, as mentioned by the previous speakers. It's also among the Sustainable Development Goals. And data-based policy is on the agenda of today's world. Therefore, we have many indicators to follow up on the problems. And we are talking about child marriages that take place before the ages of 15 and 18. And as I said, there is an indicator among the Sustainable Development Goals. We are addressing the ages between 20 and 24. This is also an age group covered by many international studies. And here our target group is consisting of women between the ages of 20 and 24. So let's talk about the data resources. As mentioned before, actually, you know, we have Hacettepe University Institute of Population Studies. Since 1960s, we have been carrying out the demographic and health surveys, and we are focusing on the last 6 of these surveys. We are covering the results of these 6 demographic and health surveys carried out by the Institute. These are very important to us. Why? Because these have international comparability and covering many country practices. And we are also benefiting from the data of UNICEF generated using the resources for child and forced marriages. And It's internationally comparable, as I mentioned before, and we are also using international data programs and databases. So it has regional levels, urban levels, and rural levels. So these are very important data resources that we have, and we have analyzed the data of these last 6 surveys. We have 3 main pillars. Since we have a limited amount of time, I will not go into detail, but about the child marriages, what's the current situation of Turkey? First of all, I would like to inform you about all that. First of all, we will look at the ratio of getting married before the age of 15. Here you see a graph. It's generated since 1978. You can see all the data up to today. And in parallel, also in Turkey, the child marriages rates are declining. And we see that the marriage ratio for this target group is around 2%. So let's look at the numbers for the ages before 18. Again, there is this improvement, there is this decline in the ratio. It was 41%, but now we see that it decreased to 15% according to the latest survey. But here we would like to attract your attention to one thing. After 2008 actually, there has been a slowdown in the decrease. Even though it's a very small-scale slowdown, there is still the slowdown, I would say, in terms of the numbers. There are those differences among the different regions. There are some fluctuations, I would say, but I am sharing the data of the latest survey to see the current situation. When we look at the 12 regions, we see that we have 6 regions above the average in terms of the rates, in terms of the percentages. We can talk more into detail about the specific regions, but what we need to know here is that there can be some regional differences. In terms of health, what we can say, as you know, child marriages especially have an impact on reproductive and sexual health, and there are those rights of women and girls. We are asking very comprehensive questions under our surveys to come up with health data. And when we look at this women group between the ages of 20 and 24, we see that the majority does not have appropriate knowledge on pregnancy and the period that they can get pregnant. So we are asking them this question, whether they know about anything, and they tell us that by 76%, they do not have appropriate and correct knowledge. So 1 out of 10 women do not even know about the pregnancy period. Getting married while you are a child would also mean that you are getting pregnant while you are a child. Therefore, using methods to prevent pregnancy is also an important topic. And the results show us that by time there has been a decrease, but when we look at the results of the latest survey, we see that actually, when we look at the contraceptive methods, the level of not using any method is at the same level of 1993. So around half of women do not use any contraceptive method, unfortunately. Again, this is valid for women who got married before the age of 18 and currently between the ages of 20 and 24. So let's talk about the reproduction preferences. So the ideal number of children was also involved in the survey. This is a hypothetical finding, but the ratio shows that it was 2.63, and the latest survey shows us that currently the ideal number of children for those women is around 3.14. And in a similar way, women want higher number of children for their own. When you look at the first columns, it's around more than 60%. So 60% of women are now saying that they want more children. So especially about giving birth, about before birth services, there have been some significant improvements in Turkey, and we realize that almost 99% of the births are taking place in the hospitals. And again, 99% of babies are delivered by the health professionals. And also there is an increase in the C-section when we look at the birth delivery methods. This is an important problem for the pregnant women who got married and got pregnant at early ages. So out of 10 women, 4 had a C-section as a birth method. And considering that they are at early ages, we believe that this is an important topic that we need to be careful about. So we are not only talking about the maternal health, but we are also talking about the infant health here. We are focusing on 2 main topics here. The first one is about breastfeeding, about nursing. This is very important because this is about the first relation between the mother and the child and the baby. It's important for both physical and emotional development. So when we look at the breastfeeding ratios within the first hour after birth, we know that the development is the case. So 7 out of 10 women actually breastfeed their babies within 1 hour after the delivery. But this high ratio is not the case for the breastfeeding percentages later on. So we are talking about babies, infants here, younger than 24 months old. So after 6 months, we are suggesting some complementary feeding, but we see that half of those babies, unfortunately, are not fed appropriately or as suggested. So let's talk about the social and cultural factors now. When we look at the educational level, this is also a very critical issue, both for women and parents in general, because child marriages are directly linked to the education level. When we look at the recent years in Turkey, there is a satisfactory increase in the education levels of women, but its impact on child marriages, unfortunately, is not at the desired level. So until 2008, among the primary school graduates, the child marriage rates were higher. And we see that now, when the education levels increase, it's also common among the graduates of middle school. So getting a higher level of education at the level of middle school is not protecting women from early and child marriages. So at least high school level of education is required, we would say. There are many other dimensions to the topic. I am trying my best to summarize everything, but each topic actually deserves to be handled separately. The decision for marriage is another important dimension. We need to discuss it comprehensively, but what we ask to them is that, is it up to your decision or the decision of your parents? And when we look at the answers, we see that in the last 25 years, the decisions of the families decreased, and it's mainly up to the decision of the individuals, of women. Women are now telling us that they got married as per their own decisions. So this is what this survey shows us. Another important topic is about the sequence and the method of marriage, because if they are not of the legal age, then they may be the subjects of religious marriages. So we used our indicators to see the figures of both marriages. We have checked whether they have handled the religious marriage before the civil marriage. And we can say that 64% of those with both marriages had the religious marriage before the civil marriage. And we have the 7% who have only the religious marriage. So religious marriage has an important role to play. So 1 out of 10 women have the religious marriage first and before the civil marriage. So we also have the traditional practices. We also have the bride wealth or price here. This is a very old tradition. This is a way of actually struggling with poverty by the parents, and the results are striking. There has been a decline, but we realize that as per the latest survey, we are still at the level of the year 1993. So we are very close to that year's practices. So now more and more families and parents are asking for the bride wealth or price. And when we look at the age differences between these spouses, this is also another issue that we need to attract your attention to. Generally in Turkey, men are older than women while getting married. More than half of those women, actually around 60% of those women get married to the men who are older than themselves by 5 or 9 years. And even though there has been a decrease, it's still at the level of 50 or 60%. So they are getting married to men who are almost significantly older than them when they get married, when they are children. And we also looked at the gender-related attitude, and we provided some statements to women. We asked whether they agree or not. And those women tell us that they actually attach a great importance to gender equality, to the equality of men and women. So they attach a great importance to the involvement of men in domestic work, or the education of girls, or participation in the decision making, are the joint issues of both genders. So we see some decrease in certain attitudes. I have to go very briefly. Maybe you may have some questions to open up some of those topics here. And the results show us that there has been a slowdown with the percentages, and education levels is important, and also about reproductive health and the sexual health. We have many problems and lack of knowledge. Religious marriage is not touched upon very much, but this is also an impact of the traditions. Those bride wealth or the arranged marriages have certain impacts. And also after the year 2018, we need to see the results, and we need to shape the policies depending on the data. And up to now, actually, they have been kind of successful in terms of having an impact on the policy making. I believe child early and forced marriages is a very social issue, and there are some reasons behind it, and it's interlinked with education, health, employment, and many other actually. So in this limited amount of time, these were the figures that I could share with you, but in the report you can see the trends of the last 25 years, and later on we can also focus more into the details of the report. Thank you very much for informing us on the report. And yes, as you said, it's a very comprehensive topic. You have shared many parameters, indicators, you have showed us many graphs, and a separate program can even be created on each and every of those. And we need to also underline this year of 2008, after which we had certain decrease in certain areas. So, of course, we can evaluate the report or talk about the report under many other programs and events. We do not have time for it right now. Therefore, we had a brief overview, but we will go into details soon. Mr. Gökhan will have certain things to say on the report. But on the other hand, also I am very curious about what Ms. Emine will tell us about, because she has contributed a lot to the program. Ms. Emine is the manager of the program. Please also tell us about the aim and also the contribution of the report to the overall activities. Please, over to you.
Thank Thank you very much for your participation, first of all. As mentioned by the representatives and SIDA representative, in terms of prevention of CEFM, there is the UN Joint Program, and it puts forward our approach studies and the importance of the study in terms of the UN Joint Program. I would like to emphasize these points. So today we are sharing this CEFM in Turkey, the data analysis of Turkey Demographic and Health Surveys 1993-2018. So with the cooperation of Hacettepe University Institute of Population Studies, we did this within the scope of the UN Joint Program. So there are many research studies and there are many data analysis went on within the scope of the joint program, and this is one of the most important ones of them. To prevent CEFM, the UN Joint Program to prevent CEFM, UNICEF, IOM, UNFPA, and UN Women, and UNHCR jointly worked together with the financing of SIDA since 2018 at the national level, and in Turkey, in 12 provinces, it is going on widely. And these studies are going on in an uninterrupted manner despite the pandemic. As was mentioned before, there are 5 UN agencies working together here, and they are unifying their specializations and expertise. So CEFM, for example, in terms of child protection, empowerment, human trafficking. So all the dimensions of CEFM is being dealt with, and also we are contributing to the sustainable development and humanitarian assistance. So we do have a holistic approach to the prevention of CEFM. This is how we struggle. And here, yes, we're talking about child, early and forced marriage. And I would like to talk about the approach of the UN Joint Program for this, because child marriage, early marriage, forced marriage concepts, from time to time, they can be replaced by each other, but all these concepts define something different. So law accepts an adult age, but it doesn't mean that this person is enough or ready for marriage. So everybody under the age of 18 is a child, and there is the Declaration, Convention on Child Rights, and all the individuals under the age of 18 is accepted as child in Turkey too. So for that reason, child marriage means that one of the spouses are child, and this encompasses official and unofficial wedlocks. And when we talk about early marriages, responsibilities brought by the marriage, so sexually, psychologically, emotionally, the child cannot bear these responsibilities. This is what we mean by early marriage. And as emphasized before, forced marriage, within this, there is human trafficking, and there is dowry or exchange of children. So at least one of 2 people is not showing free consent to the marriage in forced marriage. So for that reason, especially I would like to emphasize something here. Marriage is belonging to the adult life, and it influences the security, health, and education rights, and the right to be prevented from neglect and abuse of the child. But of course, before starting with the study, I would like to emphasize something here. So adolescence and adulthood is something different. Sometimes the kids and adolescents can be understood as adults, but indeed, they are not adults. And this doesn't mean that they're ready for a marriage. And for that reason, CEFMs, especially child marriages, and because of the early pregnancies, there might be many health outcomes and risks. And in many meetings, in many speeches, in our trainings, we are elaborating on this as UNFPA. Importantly, because maternal and infant mortality can be a consequence of these early marriages, and there might be some growth retardation in the baby, and there may be low birth weight babies, and there might be severe hemorrhage or bleedings in the moms. So there might be ruptures, and also there are these sexually transmittable diseases. So the women can be exposed to these, and this becomes a lifelong health consequence. And for that reason, child early and forced marriages has some physical, psychological, sexual consequences, and also they create unhealthiness. And all these health risks and negative consequences, these are not emphasized in a sufficient manner, and we would like to emphasize all of these, and we would like to show their importance. As our representatives mentioned, the joint program has two main goals, and both of them are integrated goals for a stronger, more efficient prevention and protection system. So what does it mean? To protect women and girls, the mechanisms should be strengthened. Along with that, to end CEFM, there has to be positive social norms, and to contribute to these norms, prevention and protection activities should go together in hand. And our program is gender equality sensitive, and also it is focusing on child, and also it focuses on the participation of both girls and boys, so it supports both. As I mentioned, in the joint program, there are 5 UN agencies, and UNFPA is one of them. And in terms of CEFM, it is dealing with the health consequences of CEFM, and also community-based violence. And also we're trying to strengthen the local and institutional capacity. This involves the provincial directorates, municipalities, NGOs, civil society organizations, including all of them. We're trying to support the institutional capacity development, and also we're trying to support the NGOs in terms of their needs, and we're trying to produce data with studies, and we're trying to execute some communication advocacy activities to be heard more and to be known by all sections of the society, and to raise awareness in this field. We attach importance to these issues, and also moms, dads, and to engage dads and boys. We are working together. And in the joint program, the most important issue is, as per in this report, to have research and to produce information and to share it, of course. And our partners, for example, there are UN agencies who are our partners. And they have carried out some different studies too. For example, for human trafficking and its relation with CEFM, and CEFM information, attitude and behavior study, and CEFM related man perception. As I emphasized before, health consequences. For all of this, there is a research report published, and with different studies, we're trying to support our stakeholders, policymakers, decision makers. So we're telling them the general picture, and we're trying to influence their decisions. So this is why we have worked together. And all the project activities, scientific studies, and the NGO activities needed to be evidence-based, and we try to exert our efforts in this manner. Of course, this is not all. Studies, yes, they are a basis for that, but capacity building and strengthening the systems and mechanisms and interinstitutional cooperation and coordination, supporting all these was another basis. So together with the UN agencies, sector specific, for example, with the law enforcement officials, with the justice professionals, media, health professionals, with all of them, a multi-sectoral and sector-specific modules and guidelines were established. And to have a local action plan, we provided modules. They were training of trainers, because after the projects are over, to make them sustainable is very important. And we supported local action plans, because in the provinces, to prevent CEFM, there are action plans. and for their restructuring to support their implementation. We are open to any technical supports. From the very beginning, we told the student institutions, and to cooperate, we worked together with NGOs. We were always hand in hand because to support their institutional capacity and also to support their advocacy and communication activities and to make them more efficient with their feedbacks, we had some needs-based assessments and works, because all the provinces have different dynamics and all the NGOs have different expertises. So for that reason, amongst the NGOs, cooperation and coordination and increasing this is very important. And in the field, to have more efficient CEFM prevention activities, we try to contribute. And also the most important thing is bringing the different sectors together. So coordination, cooperation meetings were very important for that, for the bottlenecks, for the improvement areas, and also, especially as Sedanım, you mentioned, to be hopeful, we shared our good practices too. And UNICEF's valuable representative, Regina, said that. As she said, all these capacity building activities, of course, they helped, but if we didn't have community awareness raising, if we didn't engage community in these works, then these studies would be lacking of a very important pillar. And CEFM, prevention, in the prevention of CEFM, for the engagement of dads and men, together with our partner ACEV, with dad groups in the field, with high participation, wide participation from coiffeurs, hairdressers to tailors, we reached everyone. We had some role model gatherings and we tried to disseminate the success stories, but of course, mostly to strengthen the girls and boys and to support the moms and dads, we had programs, and these were supported with the peer activities. And besides all these, with your support, communication and social media campaigns were executed. And as a result of 2.5 years, UN agencies and our stakeholders that we have cooperated together, we have reached more than 100,000 people as a result of these capacity building and awareness raising activities. And now, regarding this report, especially why is this important for the joint program? Once again, I would like to emphasize it. This report and all the produced reports within the scope of this program, and also within the scope of this program, all the field works to be executed. These will enlighten the communication advocacy activities, because this is how we will plan our activities, and the most accurate and efficient, we would like to find the most efficient way and mechanism to do that. And after these studies and works, there will be some new projects, community-based activities and field activities. For that reason, the activities, interventions in the field and the implementation strategies should be evidence-based, data-based, and this would also contribute to that. Because in all our studies, when we are planning, we're looking at these causalities and to understand the field better, to get the feedbacks in a better way, and to improve our activities, to calculate it. Of course, we're not just talking about producing data and using it. Monitoring and evaluation is more important, because we're talking about a very dynamic phenomenon and about a very important phenomenon. So it is very important, but we do not have enough time to discuss all of that. Could you please wrap up? Just one sentence remaining. Thank you very much for the warning, and please forgive me for my excitement. And the data of this report will be shared with all the stakeholders, and we would like to scale it out, and we would like everybody to reach it. I hope that in terms of shape, it will shape the policies, and it will be reflected on the field studies, and it will also guide the new projects. For that reason, I would like to thank once again Hacettepe University Institute of Population Studies, and also UN agencies, SIDA, and all the public institutions, service providers, NGOs, and academicians who walked with us. Thank you very much. I'm grateful. And now, after my long speech, now we will be coming up with the video that we have produced together with your help, the news presenters of us. Thank you very much for once again.
So these reports, these analyses are not easy to carry out. While listening to you, Miss Emine, I have realized actually you have put lots of efforts within the work. I understood it once again. Thank you very much, Miss İlknur, Miss Emine, for your valuable contribution to the prevention of child marriages, forced marriages, and early marriages. Thank you very much for your contribution to the preparation of this report covering the last 25 years. Ms. İlknur and Ms. Emine, you talked about the details and the findings of the report. Now it's the turn to talk about more details. We emphasize the importance of interdisciplinary approach and the representatives from different sectors. So we have thought about different actors. Now, during the panel, we will be yielding the floor to the different speakers. We have 4 valuable names. On behalf of UN, Mr. Gökhan Yıldırımkaya will be with us. Professor Dr. Pınar Okyay, on behalf of the academia and civil society, will be with us. Ms. Başak, on behalf of media, and on behalf of the art world, Ms. Didem will be with us. So I am very excited to listen from you. Mr. Yıldırımkaya, let's start with you. UNFPA Turkey's Sexual and Reproductive Health Coordinator you are. So what does the report tell us? How does it enlighten our way? And UN and the decision makers, how should they read the report? Over to you now. Thank you very much, Ms. Seda. Until now, we have listened to important figures. From where Ms. Emine left off, I'll pick up. For the last 50 years, actually for 54 years, the Hacettepe University Institute has been working in the sector. If you do not have a comprehensive knowledge of the sector, it wouldn't be possible for you to conduct a survey. You distinguished academics, experts, thank you very much for your support. Thank you very much for making us feel the strength in this area. And hopefully all the organizations here are feeling the strength. Lots of figures were put forward. Maybe we don't want to bore you with any further data, but once I close my eyes, what is the feeling that I feel? When I think about those children forced to marry, and when we ask those women between the ages of 20 and 24, out of 10, 9 say that I would have preferred to get married at a later age. This is about losing an opportunity because you cannot take the time back. If the subjects of the topic say this, then all the others shouldn't forget about it, because we are listening to the experiences of those people. They are concerned about their own opportunities. They are not sure about the steps that they are taking for their future, and they are kind of actually regretting the steps that they have taken. So when we look at the expectancy of life, this is 76 years for boys and 82 years for girls. So we are a very developed country when we look at the life expectancy and lifespan. But why do we try to keep the marriage within the first part of the 8 phases of our lives? On the contrary, we need to do our best to sustain healthier lives and more social lives. We are limiting the lives of people because of the forced and early marriages. This is not acceptable. There is a nice trend in Turkey, as emphasized by the previous speakers, but this slowdown of the last 10 years is a bit concerning for all. This needs to be a warning for all. What can we do to take a step further? So for this purpose, I believe everyone should allocate at least half an hour or 1 hour to read the results of the report to find some clues for themselves. A teacher maybe may say that I am aiming for a 12-year-old compulsory education, but those who are getting married at an earlier age can only get the education of 7 years. And the World Health Organization says that for the newborn and for the mother, it's very risky to give birth at a very early age. But we see that more than half of those are at the age of 16, 17, and some of them are even below the age of 15, 14, and even 13. 86% of those women cannot have access to employment opportunities. So whichever sector you look at, you realize the importance and the impact of early and forced marriage. These individuals are called children all around the world, but they are forced to act like adults. And it hinders their social, emotional, and physical development. It freezes them in a sense. So we need to have a certain attitude against the forced and early marriage. It's not only about social services development, about health, about education. It's not only about vertical areas, because it's slowing us down when we give it to a certain area as a responsibility. We are the development agencies. We are the UN agencies here. We are already covering this topic under our own programs. We do it separately, we do it collectively, and we will do so in the future. But if we do not cooperate, we cannot make sure that our voices are heard by everyone. And distinguished representative from SIDA already mentioned their great support, and thanks to their financial support and thanks to the support of the other parties, we have achieved a great progress. And we have many institutions, organizations, and partners working in these areas of employment, safety, security, justice, education, health. So with the private sector, with the NGOs, with the academy, with the press, with the media, this common stand is a requirement. We shouldn't do something once it happens. We need to do something before it happens. We need to do something to prevent all these collectively. We need to create a tangible roadmap. This is what we are trying to do. We are trying to come up with the monitoring, evaluation, feedback mechanisms. So we are trying to name each and every step. But we shouldn't forget this. These young people are the subjects of these incidents. We are talking about young women. We are talking about girls here. If we keep them aside, we cannot be successful. Young and youth participation is very critical. And we are trying our best for the compulsory education. And if we involve this in the curriculum for the younger age groups, maybe later on, many preventive activities would be possible, because they will make sure that their voices are heard at a louder volume, and they will work together with their parents, with their teachers, with their guidance counselors, so they can make these decisions at the right time. Once they postpone this decision to 2 years ahead, 3 years ahead, then it can be a healthier marriage. Everything is up to us, but we shouldn't do it alone. We need to also involve the young women, young girls. We need to also involve youth, and we need to reflect everything onto the curricula of students, and we need to involve teachers. But we shouldn't forget one thing. Turkey is one of the most important countries who are obeying the sustainable development goals and objectives. And as a country, we are doing reporting and monitoring in a very well manner. So we don't want to come across some unpleasant surprises. And if we want to do that, we need to do our best for the prevention of the forced and early marriages, because this is a triggering element. Once you have this brick missing from the wall, from the pyramid, then your pyramid may collapse. Therefore, we have important colleagues, important representatives and partners here. On top of what I are going to say, I would like to emphasize the importance of collective and tangible steps once again. We need to stand strong, we need to allocate budgets, and we need to make sure that we use the monitoring and development tools, and we need to have relevant publications all the time, and we need to cooperate with the public institutions and private sector, and also with the civil society. I believe we can just clean the dust off on the development, and we can eliminate this slowdown. Once again, I would like to thank you very much. Thank you. We need to realize the existence of young people, of children. You have conveyed some important messages. You need to tell us what the decision makers should do, and you have underlined very important points. Thank you very much for that. So we would like to also listen about the perspective of the academy as well. From Hacettepe, Professor Dr. Pınar Okyay. We would like to yield the floor to you now. Let's continue with you, and you will have the perspective of academy and the civil society. So what can the civil society do?
Thank you, Seda Hanım. So distinguished representatives of UNHCR, UNFPA and SIDA, and distinguished participants and distinguished researchers of Hacettepe University Institute of Population Studies, I am grateful for everyone who worked in this study. So 15 years ago, in a first primary health care institution, I was together with the medical school students. So before we had cards, to follow the pregnant women, and I was looking at one of these cards, and the story was two stillbirths and 2 miscarriages and 1 live birth, and the door was opened, and that young girl, and the age written on the card was 18. I saw them together. So she was married at the age of 12, and she had the 6th pregnancy, and she had 2 babies. I do remember this very vividly. So she was deprived of all of her human rights. And for 10 years, for more years, long years, she lived with us, but she was like invisible, and all she lived was extraordinary and unacceptable, but it was like normal for her. So child marriage was accepted as normal. And today, still, such children are with us, are among us. As told by the other participants, every year 12 million girls are forced to marry at their childhood. So for that reason, education, right to health, education, and employment, they are deprived of their fundamental rights. And this is not normal. This is a violation of human rights. So we need to advocate this. So we, as academicians working in the academia, from the very first years of our education at the bachelor's degree and master's degree, we're explaining this to our students. Now our hands are stronger. With this report, based on data, in a stronger manner, we can tell the situation to our students. And in our NGOs, in our specialists NGOs, with our target audiences, in every training sessions that we have, we give space to this in our advocacy works. Now our hands are stronger. With this report, our advocacy can be based on data and in a stronger manner. And as the Association of Public Health Specialists, we are working closely with UNFPA Turkey office. And now we do have a course program called CEFM, and with their support, we're executing it online. And in this program, as Emine mentioned, we are training trainers, so we are carrying out TOTs, and also from different disciplines, we reach 500 something experts. And the data will be also in our programs too. So our hand is stronger now. And now we have reached a very important information too. So to carry on, we have been strengthened because up until today, we had multi-sectoral efforts, but within the years, they create difference. And this report shows us this difference in an evidence data-based manner, but we are not at the end of our journey. Still between the ages of 20 and 24, 1 out of 7 women are forced to marry before the age of 18. And more importantly, for the last 2 years of the research, the decreased trend cannot be kept, cannot be carried on. And there are some regional disparities in our country. And because of the scope of this data, this also involves the data sets before the pandemic. And when we think about the pandemic, we can think that now the difference and the trend is different. And today we still need our support here. We have to act as comrades here. So in terms of prevention and protection activities, we need to sustain our activities. In the report, in the issues, we see that there is a homework of research. So as NGOs and as academicians, we do attach importance to that. And we know this homework to leave no one behind and for a more equal world and for a world with happier people, we need to carry on working. And without postponing, we need to do this today. And as Gabriele Mistre says, we are accused of many negative things, but our biggest fault is quitting our children. All the other things can wait, but children cannot wait. Now they're being shaped by their bones and senses, so we cannot answer them tomorrow. Their name is today, and we have to leave everything we have at hand aside. And with this report, with a more equipped manner, we can work on these issues more. So we need to give the rights of the children immediately because their name is today. Thank you very much for this kind invite for once again. And I would like to extend my thanks to the participants for their participation once again. Thank you very much for your speech, Pınar Okyay. She shared the information and also she gave us some warnings. So there are some lessons to be learned in her warnings. Now the report and the findings. And we need to share this with the public. Of course, this here, media has a duty. Başak is here with us. So journalists, when creating news, how they use the data, and also I can put it forward likewise. She can use that in a way that to make it more understandable and to support this work at the same time.
At that point, reaching out to data and interpreting the data and having the relevant capacity are important, because having access to data, reliable data, is a problem on its own. But on the other hand, as you mentioned, interpreting the data and shaping the data, making it more understandable is whole another topic. So all these correspondents working for the press agencies need to have skills and competencies. There are some resources that we are feeding on. We can check upon those resources, but having access to them in a compact manner is not very easy. Data journalism comes in. What I mean, we see the table, we see the statistical data, but how do we interpret the data? This is something wholly different. Data journalism is unfortunately not very common in Turkey. I am not very hesitant about talking about it. Data journalism is important, but to what extent it's important in Turkey? Maybe this is what we need to discuss, because once you cover news based on data, you give information on important issues. These are very sensitive issues. For example, child and early marriage. It can just be on the agenda of the whole Turkey. But if it's not that famous, or if it's not attracting attention, then just providing figures on marriage wouldn't be that important for people. When we look at the demographic and health surveys of Turkey, these are golden for me. I am also referring to those resources quite a lot while providing and preparing my news coverages. They are very in-depth and they make you think. So if you need to take a picture, take the overall picture, you need to take a look at those surveys. Making children marry at an early age is a very difficult topic to be covered by the news, by the journalists. So you need to be very sensitive while covering it, because it's binding and it's hurtful. You may think that you are not making any mistake, but you can still make a mistake and you can really wound people. You maybe want to put forward the current picture, but you may even deeper the wound, unfortunately, for some people. And there needs to be reflexes, sufficient enough. But if you want to cover something legally, and if you do not want to some bad, ill people to have your news and shape it as they want, you need to act based on the data. The political scene may change in the country. It has always been this way. But if you want to do something legally, you need to act on the data. Reaching out to data and reliability of the data, these are all separate issues to be handled, because you cannot have access to each and every data. These Turkey demographic and health surveys are golden, as I said, because they provide updated information every 5 years, and making it visible, making this data visible is up to us as the journalists. Sometimes they are very academic, not sometimes, but all the time actually. They have a very academic language, but we are providing this data for the all community members. So I need to make sure that everyone can understand the data here from the survey. So you need to be able to read the data, interpret the data, and for all these you need the competencies and you need the experiences. And this is not what we have in Turkey. If you ask whether it needs to be at the desired quality or the quantity, this is my answer. Yes, we had good journalism in Turkey, that's right. But when we look at the overall picture, people do not read newspapers. Still, the community is feeding from the TV coverages. But what's the quality of work on the TVs? Not much, because they do not give the journalists enough amount of time to make their research on the news to be covered. And this is not the expectation even. But as I said before, there are those people who are good journalists. And we need to do this identification very well. Whenever you are, wherever you are, it can be the south of Turkey, east of Turkey, or the central Turkey. People move, but their traditions do not move. Their traditions stay with them. When I look at the report, I see that after 2013, child marriages increased in the Southeast Turkey and the Mediterranean region. Also, we see that marriages among the relatives increased. This is 10% decrease. And also the bride price and wealth increased as well. So the duty of the journalist is to provide this data, but on the other hand, also to provide the reasons why. What's behind? Why? How? These questions should be answered and actually asked by the journalists. And human stories are involved here. Figures are figures. They tell us a lot, but sometimes the figures do not tell us anything at all. To be able to touch upon the lives of people, hearts of people, for people to be able to connect with you, you need to cover the human stories. Pandemic, social economic structures, government policies, migration, these are all elements, but independently from those, you need to be able to read the data. It will bring us to a certain level, but we will still have something missing. At that point, the field comes in. We have researchers collecting this data and involving them in the survey, just like in the same manner, journalists go to the field and collect the data. It's not about the live broadcast. It's not about the data that you obtain. You need to cover human stories. You need to make sure that you are telling everything through human beings. And unfortunately, the picture is not very bright in Turkey. This is what we have seen. I hope we would be talking about different things here right now, but unfortunately, these are the things that we have been talking about for many years now. Media, international organizations, civil society, we all need to stand close to one another, feed one another, and we need to act together. And the press and the media should care more about the quality rather than the quantity. Hopefully, in the future, we will have a clearer manner to progress forward. Thank you very much, Ms. Başak, for your comments, for your remarks. Thank you very much for your self-criticism as well. It's very important for us to know about all these from an insider. So, Ms. Didem, UNFPA Turkey supporter, distinguished artist. You have been with us for a very long time. Thank you very much for listening. Now we are 5 people on the screen all together, but actually we are not 5, we are 6, because with you, we have another name listening to us quietly. You have a minor in your belly. Hopefully you will meet in a healthier manner soon. So, what's the contribution desired from the media for this fight? You have listened everything for this 1.5 hours. So what do you think as a candidate of being a mother? Please.
All you said is very valuable, but my hormones are very active. So I'm at the 8th month of my pregnancy, so I am influenced a lot by these talks. It's okay, but only if we can influence more people, of course. When I was listening, I was sad about that. And also on my phone, I am checking the YouTube account and the messages and how many people is following. And I am sad because we couldn't reach many people with this broadcast. As actors, as researchers of this data, we are doing our best. So these are incredible reports. And on the side of media, Başak Hanım, Gökhan Bey told very impressive things, but our biggest problem is, as Başak said, to go to the field and to touch the people. So our opportunity here is very low. So as an actress on the theater scene, I can act about this, but the audience, the cultural level, their perceptions, and they are aware, our audience is aware, so they are opposing child brides in the audience of theaters. But we are looking for is the girls and moms and dads So the ones who never went to theaters in their lives, who couldn't come together with art in their lives, we have to touch the lives of these people. When Emine Hanım was explaining, she talked about her incredible activities. This is the most important thing. We are role models. As an actor, my biggest aim is to build up empathy with the people I come together and to act as a role model to them. Only if they could listen this broadcast. I was married at the age of 38. My career was always on the forefront, my priority, and a marriage, a man, a financial power. I wasn't always in this feeling that this would help me because I was doing it myself. And when I tell this to someone face to face, I think I can influence them. This may be the girl or the moms and dads. The most important thing is this, I think. And now being pregnant, expecting at this age is an incredible emotion, being aware like this. So age 20, at the age of 20, I was at university. I was at university when I was 17. I was at class 33. And I cannot imagine that I was witnessing the same things that I am witnessing now. Of course, state banning this is very important, the marriages under the age of 18, but there are some secret or unofficial marriages going on. Just if we can go to the field, we can find them. If we can contact them face to face, one to one, I think we can reach these people. So here, what is our advantage? So by TVs, we are in their homes and they trust us because we are acting a role that they like. For that reason, they look at us with the feeling of trust. Yes, I love UNFPA. I'm always their supporter. And if they tell me, for example, we're going to the Southeast Anatolia, we will be visiting 5 families and we will be telling them why should be pregnant later, why shouldn't be child marriages, I can say okay to them and I can go in that way. And I would like to do that. I think many actors would do that. And with a girl starts everything, as Hasan and Gökhan said. Yes, we need to do our best. Me as an actor and with my actor friends in this field, we will be supporting anyhow. Thank you very much. Thank you very much. So TVs, can they contribute more, do you think? Because a theater audience, you said, yes, the audience of theater are aware and are at a very certain perception, but TV audience is more comprehensive. So when we talk about TV audience, soap operas, TV series can handle these issues, yes, but a remote control, on the button of remote control, they're there. So the audience, if they do not want to face any issues, then they close TV, they switch off the TVs. So for that reason, we cannot blame the TVs too, or soap operas too. So they are showing violence or this and that. This is about the perceptions of the people. They opt for watching or not. So for that reason, yes, soap operas, TV series are important, but influencing the audience is important. Changing the consciousness is very important. Yes, they can watch something they can like us, they can believe in us, and I can go there and I can convince them as them one-to-one. This is my opinion. Thank you very much for your contribution. Thank you very much. I hope that you will hug your baby healthily soon. And Gökhan Yıldırımkaya, Professor Pınar Vakyay, Başak Çubukçu, and Didem Balçın was in the panel. And we talked about a report in this panel and this interdisciplinary issue, the stakeholders of this interdisciplinary issue, how they work. We evaluated this. Of course, the report is very important. I would like to remind once again, in Turkey, CEFM, Data Analysis of Turkey Demographic and Health Surveys, 1993-2018 report, and Associate Professor İlknur Yüksel Kaptanoğlu shared parts of it. Emine Kusutürk Savaş also contributed. And from the very beginning of our program, some organizations contributed to the program like UNFPA Turkey, they are the host. UNICEF is another contributing agency, and SIDA and Swedish Embassy. We would like to remember them too. So for girls and women, to make them away from violence, to make them live healthier and more efficient lives, and to realize their full potential, we need to struggle with violence, discrimination, CFM, and all the harmful practices. We will be continuing to struggle. It needs more efforts. I am now once again aware. For that reason, I am thanking all of you, and I'm happy to be here too. I am glad to meet all of you. Thank you, UNFPA, for giving me this opportunity. And if you are wondering the full report, our audience now is following us. And we may not have many followers at the moment, but for the ones who will watch it together, I think it would be higher. For that reason, this is a reminder for them. UNFPA Turkey website. From that website, you can watch this. Whenever you want, you can listen any part of this broadcast, and also from UNFPA Turkey channel, you can reach the report. Thank you very much for your participation once again, and also thank you very much for listening, dear audience. Thank you.